Hi, Kevin Henry, the Group Editorial Director for UBM Medica's Dental Division, and I'm on a Google Hangout with my friend and the front desk lady, Lisa Marie Spradley. Good morning. How are you?
Good morning, Kevin. I'm good this morning. How are you?
Hey, doing great. Always a good morning when I can chat with you, and a good morning whenever you can offer some of your expert advice on dealing with problems in the practice, especially the communication problems that arise between the front office and the back office. And I know
Mhm.
that you've seen this in some practices that you've worked with, correct?
Oh, I have. I have. It always kind of amazes me when teams just don't talk to one another. It's like we spend all this time and effort talking about the importance of communicating with our patients, but we have to communicate with each other first in order to communicate with the patients well. At least that's what I think anyway.
So what are the main things that you see with communication? Is it people just not talking to each other, or are they assuming things? What's the biggest hang up?
Well, it's actually a mixture of all of it. There are morning huddles and we're discussing what's happening, who's coming in. But then other team members are just standing there. They're not really getting involved. It's kind of a woe is me attitude. And it's, it's depressing for the entire practice. And then, of course, unfortunately, that attitude is or atmosphere is reflected for the patients. So it's always, I think, very important, especially in morning huddles, to go around, let everybody have a say about, who's coming in or any thoughts that they have, something that's happening that maybe someone feels like they've been slighted. And it's just amazing how no one will actually just say what's going on. Instead, they want to internalize it and just make everything about them instead of a team effort.
So let's say that there's somebody in the practice that you see is kind of
Mhm.
off to the side, not participating, not being that team player. Do you confront them one-on-one? Is it more of a in public? How does that work best?
Well, it's always best, especially if you know there's a specific problem, not to confront, in person. But what I like to do is like when you're in a morning huddle, I like to try to, as I said, go around and get everyone to, give us some feedback on the day before. And if I notice that they're not really doing it after the morning huddle, then, I think it's always a great idea to, just kind of say, hey, is something going on? Or is there a problem? Or do you have something that you'd like to say? Just that one-on-one time. And if they're still not, willing to open up and tell you what's going on, then, the best that I can offer is, okay, well, when you're ready, we're here, we'll listen, just communicate with us. We cannot help you if we don't know what's going on. And a lot of times, maybe someone will, it'll make them think and they'll come back later. But, it's just very important to keep those lines of communication open. And I think that if you're able to do that, then of course you're going to have a happy office, and a happy office is going to have happy patients. And I think that that's what everybody needs to realize. We've got to have a happy team first and foremost, and then we can work on patients.
Well, and I think you touched on it a moment ago. Patients can tell if something's wrong in the practice, and none of us want to be in an uncomfortable situation, especially if the patient may already be nervous enough coming into the practice and then go, oh my gosh, these people really don't like each other. I'm not sure that I want to be here.
Yeah. And a lot of times it's not always just a team that creates conflict. It's the dentist that can create conflict too.
No,
So
really?
that it's unbelievable. But so then the team member doesn't want to say anything in front of the dentist. So that's when, being a really in tune and knowing what's going on with your practice office administrator, you have to be able to be that between your team member and your dentist. And it's not always easy to do. I get that. But sometimes you got to do those hard choices.
Well, and like you said, that's a little bit of an uncomfortable situation for the office manager or the front desk person to jump into, yet it's vital that the situation's cleared as soon as possible, right?
Right, right. I mean, because the last thing you want, and we've all heard these horror stories where, the dentist is throwing things at the assistant, or the assistant is, just totally disregarding what the dentist is saying. So we have to all make sure that we are working towards the same goal, which is taking care of our patients. And that means sometimes, just like when we're in a family situation, we're going to have a disagreement, we have to get past it and just not dwell on it.
Now, last question for you, because sometimes the office manager may be the problem. And so
she could be, he or she.
Yeah, absolutely. So if suddenly you realize that you're the problem and you're the one who's kind of pulling back a little bit, what's some advice that you would give to kind of push past that for the good of the team?
Well, I think ultimately what we have to remember is that we are there as leaders. So we're not there as, it's my way or the highway. And sometimes that's the mentality you get. You're the practice administrator, so you're right. You don't question me, kind of thing. And I think if we can step back and realize, okay, this is a team effort. Be open-minded, and never, ever, ever, this is very important, Kevin, never be afraid to say, I'm sorry. Even if you don't feel like you did something wrong, apologize that someone felt like you did something wrong. I think that's a huge step. I am so sorry that you thought I was saying this, or, that you interpreted something. Maybe you didn't do anything wrong, but being humble and just be willing to say, I'm sorry, is a huge step towards mending these fences.
Great points, my friend, as always. And I know that personally, you've got a new venture right now, and I'd love for you to kind of share that with our audience.
Oh, I'm very excited about it, Kevin. It's called POP, which is the purpose of the practice. And it actually has a lot to do with communication, because I feel that when the team knows the practice's purpose, whatever that purpose might be, and you're communicating it with everyone, your team members, your patients, anyone you come in contact with, you're not only going to be a healthier practice, production and collection-wise, you're going to be that happier practice. When you have people that all feel the same way that you do, and you're all trying to achieve the same goal, wow, I mean, it's not a job anymore. It's a career. It's something that you love to do. And that's very important in this day and age. That's what we all want. We want to do something that has meaning to us. And that's what purpose of the practice is all about, finding that and being able to communicate it.
So tell people how they find out more about not only you, but also that new program.
So you can find me on online at frontdesklady.com. I've also recently made the big revelation that I can change my my Facebook page to Front Desk Lady. So you can find me on Facebook at Front Desk Lady. And POP, the purpose of the practice, is going to be a weekly video vlog, is what I'm calling it. So every Monday I will release a new vlog, and I'll be speaking to not just industry experts, but anybody in the dental field that has a purpose and how they express it and how others can learn more about them. So I'm really excited about it.
Oh, as well you should be. And it's, just to give Lisa Marie a little prop here, she's always been kind of that go-to person that I've thought about with the front desk and the office manager side of things. And just in case you need to remember that Lisa Marie was actually voted as the Office Manager of the Year recently by the American Association of Dental Office Managers. So she's kind of that shining beacon out there as far as the front desk goes. So I'm thrilled to not only have you on, but as always, to have you as a friend. And I look forward to seeing you very soon at another dental meeting.
Yes. So they're all coming up quickly.
All right, Lisa Marie, have a great day. Thanks so much.
Thank you, Kevin. You too.